Good evening, viewers. Scores of tourists are flocking to the hill stations. Overcrowding being witnessed in several parts of the country as more and more cities and towns unlock. As we leave the worst and the peak of the second wave behind, with each passing day, we are forgetting very quickly. And the scenes that we are witnessing across the country are just getting a little bit more horrifying. Amidst all of this news of crowding at tourist spots and opening of crowded markets, we also now have the big challenge of the festivals and the religious yatras and the religious congregations and events that are already happening or coming up across many states in our country. Amidst all of this, the Indian Medical Association has issued a stern warning to states against the third COVID wave, saying that holding festival now is not advisable, that it can be dangerous, and you must reconsider the decision on mass gatherings. The Indian Medical Association, the IMA, has highlighted that the third wave is inevitable and imminent. People engage in mass gatherings without protocols, tourist bonanza, pilgrimage, religious fervor needs to wait and can wait. And we actually saw that despite repeated warnings from the central government, despite commentary coming in from the Prime Minister, despite states issuing warnings, despite the Indian Medical Association and every other expert talking about it, we were flooded with visuals of tourists who were thronging to markets and beautiful scenic destinations in the hills, wherever possible, flouting the basic COVID norms, not even bothering to follow norms. Now, whether that was in Shimla, whether it was in Kasauli, whether it was in various parts of Uttarakhand, in Dehradun, whether it was in Leh and Ladakh, Lonavala in Maharashtra, Dhanolti in Uttarakhand, it was the same. And the cops who are responsible for penalizing violators had a really tough time. Some people were arguing, challenging, promising they will go and buy a mask and wear a mask. Others said not required. Some claimed they were eating. Others refused to move from these locations until the police got really, really strict. Now, the first weekend and the second weekend we understood, but when this continues day after day after day, then it becomes a big problem. Add to this, one might say, why should the common man and the regular tourist suffer and not try to escape the heat wave when everything else is being allowed in this country? The Rath Yatra has begun in Puri, although there are very strict regulations that have been put in place on paper. RT-PCR tests, only a few thousand of people involved in the ceremony to be allowed. It's not open to public. Many others who are involved in the construction of the chariot, etc., have been in kind of a bio bubble. But still, the visuals that came across were not very satisfying or assuring. It did raise the question of, are we really teasing COVID? There are now conversations about other yatras, including the Kanwar Yatra, whether it should be held or not. Uttar Pradesh and Uttarakhand are of the view that they will with COVID restrictions. Is it possible to really bring in restrictions for large crowds, for large-scale events? Haven't we seen that in the last one and a half years that it doesn't matter? The minute you open up something in our country from a market or allow for a festival to be held and celebrated, all norms go for a toss. Can we afford this right now? Have we not learned any lessons from the second wave? I say good evening to Dr. Jayalal, President of the Indian Medical Association, Dr. K.P. Aravindan, member for the Kerala State Level Task Force, Dr. Subhash Salunke, Senior Advisor for Public Health Foundation of India, also a member of the Maharashtra Task Force, Vivek Reddy of the BJP, Mahesh Tapase of the NCP joining us right now. Let me actually start off with Dr. Salunke on this. Dr. Salunke, the festival season is just about is around the corner, and not for one state, but for multiple states. So states like Kerala and Maharashtra, we continue to see that the numbers are not coming down beyond a level, even though some of the restrictions are still in place. Are we now tempting the virus, teasing the virus, and taunting it by attempting to hold these events, large crowd gatherings?
Tanviji, I think we are not tempting the virus, we are insulting the virus. And this virus doesn't like the insult. These festival seasons are every year's occurrence. It is not that only this year these seasons or these festivals will come. They will come also next year. But the way our population is behaving, and as I was explaining earlier also, and the majority of them are so-called educated or so-called literate. Now, these are the people who are not only flouting the norms, but they are really causing a kind of a damage to themselves, to their family, and obviously to their nation. Now, this particular issue comes to their mind only when they fall sick. See, only when they have to go to hospital and when there is no ambulance, there is no oxygen bed, then they will start criticizing the administration, the government. When everything is in their hands, they do not want to follow that, and they want to go to Shimla and Manali and many of the tourist destinations. I am really surprised how idiots we could be. I mean, this is the height of stupidity. Knowing fully well we are inviting the problem, as I explained, this virus is not going to accept this kind of a treatment. And they look at the way, even in the countries where they were thinking of not wearing masks, some of these guys were saying in UK, they will say no mask. WHO has come out with the clear indication that if you do it, it will be at the detriment of your own health. So let's not do it. But at the same time, there are ways and means to enjoy these festivals. You jolly well do that. You follow your religious tenet. You follow your faith. Nobody says that you should not. But at the same time, you can have a balanced approach. And that is quite easy, quite possible. You don't have to only wait for the police to implement that law. It is quite possible, but provided there is some sense of wisdom that we respect rather than we behave in a fashion where we are so short-sighted that it is just this week or next week or whatever that particular part, and we don't bother about the few months next. I was explaining that if you 70% of Indians, if they are vaccinated with 2 doses, follow the COVID norms by just wearing mask and even a small social distance up to December. Just do it up to December. Next year, you can really enjoy your festivals, your religious festivals or whatever. Just do not give opportunity to this virus to multiply. If we do that, next year will be yours. Enjoy that. Do not allow the mutation to be taking place in this present situation.
Right.
You will be able to enjoy it next year. If you do not follow these, you will not only not enjoy next year, you may not be there on this earth. You, not only you, your family, your children.
Right.
Why don't you think about it, please? This is an appeal. Appeal to those who are unlikely to listen to even IMA. If they are not listening to the Prime Minister, IMA and us.
Well, people are not going to beyond a certain point. I think in the last 1.5 years, that has become very clear that people on their own do not. And when there are, so many examples around you, when political rallies are okay, when big functions of administrations are okay, when religious congregations are okay, then, each individual takes that as an excuse, though they shouldn't, and turn around and say, well, why should I not get away for a weekend? Why shouldn't I not be able to travel, drive down with my family, and grab some food outside of the city and come back? That's the point, Dr. Jayalal. So is it then the responsibilities of the states or the center to come back with some of these restrictions? Where do we find the middle path? How do we ensure that tourism and economic activity doesn't get impacted, people are allowed to get out, but we don't really get the third wave before its time?
Yeah, it is very evident that if we are not following the code appropriate behavior, we are going to end up in the third wave and end up in the disastrous wave. But now we have gone through last 1.5 years. We know now all the economic experts and the financial managers, they must have found out some means and ways by which the economy could be also restored even amidst with the COVID. So I do not find any reason saying that economy is the reason for the people to come out. There is a small, when they are coming out for the small sales or not, we are not talking about that. When people are going for a holiday in a pilgrimage site, people are going to the holidays to the hill station, people are going out for the religious festivals, or people going for the sports events in a large number, knowing very well that is going to be hazardous for them. I'm sure it is not the economy, it is only the mindset which is going to be happen. It cannot be controlled by only by the government, nor by the public alone, or the media people, or anyone is involved. It is an involvement of every one of us to, if it is a first instance, yes, the role of government is very much there. But now, having gone through all the pain, knowing very well the pain of someone close to us dying, not even able to say goodbye to them at the moment, but still if we are falling prey to that, it is something like a firefly, seeing the fire, it knowing very well it is going to disturb them, but still falling onto this is a quite dangerous one. So I do not find any reason that it is can be blamed on the government or blame on the someone else. It is a responsibility of everyone involved in this, right from our medical profession to the people involved, has to take a positive decision for safeguarding personal self. It is not that even if the government is relaxing, if the people cannot understand it is their life and their family life and their society contribution is important, and we cannot blame that. But I think what appeal to the government that they should be also proactively, they should also come out with the zero tolerance against non-COVID appropriate behaviors, and that has to be implemented with an iron hand if it is necessary. But this is not a situation to take it in a light way. Another 2 to 3 months, if we can self-guard ourselves, definitely we will be in a positive situation.
Okay, so let me then ask, Mahesh this question, because Mahesh, Maharashtra is that very interesting, it's, the data shows a very interesting trend where we're not really seeing a further fall in cases. We've not seen a big rise either. We are just plateaued, and we seem to be now stuck at that level. So we don't know whether we can open up more or, or continue at these levels. And the festival season is coming up. Plus, people from Mumbai, Pune are just, thronging to these local tourist destinations, which has obviously become a big challenge for the authorities there. What is the thought process? How are we dealing with this challenge?
Good evening, Tanvi and all panelists and all viewers. I think it's a very important discussion that your channel has taken up. And I really applaud the efforts taken by the Indian Medical Association in telling the people, in appealing the state governments and appealing the people at large not to indulge in tourism in a very high level. I mean, of course, a little bit a few can go, but the way that people are thronging the tourist destination, whether it's the Himalayas or the northern India or Mahabaleshwar or any other Lonavala in Maharashtra, people are going. See, I like one more word that you said, Tanvi, the middle path. Oh, we are a country where middle path has been preached by the religions formed in India, whether it's the Jains or the Buddhists or the Hindus, but we don't practice the middle path in our life. We want to take everything to the extreme. The society, we want to take everything to the extreme, and then blame the system, blame the medical fraternity for all the things that happen because of our extremism. So, nevertheless, now the figures are plateau. I mean, we don't know what's actually happening, how the mutant virus is actually going to develop. We are reading about the third wave. We are reading about the Delta variant. Currently, there seems to be a plateau, but that plateau does not indicate a downward tanking of the graph. It might again just shoot up. So no, we don't know. We don't know how the plateau is going to, whether it will be an upward reversal or a downtrend. So we don't know at this point. Nevertheless, it is an earnest appeal to all the citizens of the country and the state of Maharashtra. Please adopt COVID appropriate behavior. I think Indian Medical Association has rightly put in a very earnest appeal, and we should. I mean, they are our gods who have saved us in the last 1 year. They are the people who have, not looked for their own life, but served the humanity, served the larger cause of saving millions and millions of people in this country. So when our God is telling us to adopt a COVID appropriate behavior, I think this is the least that we can do and abide by the clarion call given by the Indian Medical Association. I would definitely say on record that my state government, the CM of Maharashtra, the tourism minister, the health minister of Maharashtra, the deputy CM, we are all appealing to the people. We are We are opening up, but we are having a very cautious and a close watch on the figures. The rapid testing is happening, RT-PCR is happening. The figures are looking good as of now, but we don't know when they might surge. There's a festive season just around the corner. Shravan might also come after the monsoon. There's monsoon season. There is natural viral infection in the air. So all these things clubbed together are a very, very risky phenomena, and we don't know what will have come. But again, I thank your channel for having taken up this very, very bold discussion in appealing the people right from the channel, right with the Indian Medical Association, right having the political people along with you.
Right, but
And
here is the concerning part, and you're saying you're watching it very closely, because what I am looking at, and Dr. Salunke, quickly to you before I move on to Dr. Aravindan as well. We were looking at this latest report, research that has come from a Chennai institute, which talks about the R0 value, the infection rate that gives us a sense of how quickly it's spreading. And for states like Kerala and Maharashtra, we seem to be inching very quickly towards 1 again, and beyond that it becomes a concern. Now, why is it happening? Do we have any answers to why again? Is it because people are stepping out? Is there another reason?
Yes, obviously that is one of the most important reasons. And please remember that Maharashtra and Kerala have a distinct difference between other states. It's because of two reasons. One is the urbanization and the congested population that exists in the urban areas. Look at the way Pune, Mumbai districts have behaved. Initially the infection has a concentrated, sort of an occurrence in the urban areas, then peri-urban areas, and in the rural areas. And second most important point which is coming up is the mutation that we have seen as far as Delta variant is concerned, and that's where the R0 has increased. And there is definitely a worry that the viruses go on mutating. It's not that it is going to remain always there at the one particular constant feature. So Delta plus and whatnot, there are 8 or 10 varieties already circulating throughout the globe. So the worry is that it is quite likely that the further mutation will result into transmissibility more. Fortunately, till this time, the virulence is comparatively low, and that virulence part is giving us, you can say, a sense of, maybe people feeling, because there are not many deaths, but they can occur, and that is going to create again the panic, and people are going to again rush for debates. Right now, in some of the cities in India, including Maharashtra, the critical care beds or the beds in ICU are slowly getting occupied more. And that is a warning signal.
Yes, and why I want to talk about this, and we repeatedly highlight this, because even as we were in the months of February, when there were some signs in a few states, the conversation was always on, oh, you know what, the crowding instances, the political rallies are taking place in one part of the country, but the cases are going up in the other part of the country. So it doesn't matter. We were reacting in such small little silos and not looking at the larger picture, and that at the end of the day, the entire country ended up going through the same second wave. So we shouldn't be falling into that kind of a trap again. Dr. Aravindan, how do we walk this tightrope, maintain the balance where you understand that at some point people will say they need to get out, but if you open up too much, then it just calls for more trouble?
Basically, two things. Following up on what Dr. Salunke said, I think the single most important thing that you have to look at is that the hospital capacities are not overwhelmed. So what it means is that the graph should not rise very steeply. That should be our main concern. Unfortunately, this is what happened in many parts of India during the second wave, so that the hospital systems were overwhelmed. People did not get oxygen, and you saw such panic situations so many places. So essentially, as long as we can try to bring down the steepness of the graph and keep it lower, then we will be able to manage. And for that to occur, it's not the TPR that you should go by. See, unfortunately, we are looking, everything is now being judged by the test positivity rate. Test positivity rate depends on whom you are testing. See, like what is happening in Kerala. Kerala, right now we are testing a very large number. Every day it's about nearly 1.5 lakh people are tested, mostly by RT-PCR and also by antigen tests. And we are testing mostly the people who are likely to be positive. So the high suspicion people are tested so that they can be quarantined or isolated. Their contacts can be tested. See, whenever you do that kind of strategy, you are likely to have a higher TPR. You should not be worried by that. What you should be looking at very carefully, as Dr. Saluke said, should be the hospital bed that is occupied by COVID, the ventilators, the ICUs, and Kerala, I think right now there is no need for panic. We are actually managing it, and even the controls are there already. And I suppose compared to many other places, wearing of masks and other things are better done here.
So you are
right
saying
now,
partially a reason for why Kerala is still seeing, a rise in numbers is because your testing is very targeted.
Yeah, very targeted. And another thing, this has been the experience of most countries that have actually managed the COVID rather well. It comes down. From a peak, it comes down and then plateaus, and that plateau remains for some time, That should not really cause you worry, particularly with the Delta variant. Delta variant actually spreads very so fast that it is very really difficult to control and bring it down to a baseline is very, very difficult. So as long as you can maintain this plateau, you can maintain all the social distancing measures, which should, I underline that we should continue for some more time, no doubt about that. So we maintain all these measures, then we can even avert a third wave. It's not inevitable that a third wave should come. We can avoid the third wave, and meanwhile, we have to step up the vaccination. Ultimately, vaccination is our only hope. So we have to step up the vaccination, and a lot of it actually depends on the vaccine availability. Finally, almost everything boils down to the availability of vaccine, whether enough vaccine can be made available to the entire population, let's say by December, whether we can populate the entire population can be vaccinated.
Okay,
so that's the central government's call basically.
Yes.
And it is up their responsibility to ensure that.
Well, yes, whether they're able to do it or not, it depends on the vaccine availability. Now, but let's assume that, the central government is doing everything that they can, and they are going to be able to August onwards to ramp it up. So far, July hasn't shown very encouraging numbers. Then the overall expectation is the same as what was for June. But with Mr. Vivek Reddy, to you this question then. If we are hoping to vaccinate a majority of people by December, why don't we just as a collective nation and as the central government and state governments send this message to people, just hold on for 6 more months. Don't get so fed up, don't lower your guard, don't start celebrating right now, because COVID is not gone anywhere. COVID is not over. A third wave, maybe even a fourth wave before vaccination target is completed will take place. Why are we not saying it more emphatically across the country?
Well, I think, Tanvi, first of all, the advisories issued by the central government are very clear that there is a variant and it is a variant of concern. I think all the protocols that get triggered because it is a variant of concern will be put into motion. And as soon as the second wave got down, the government sensed that there could be a probable third wave, and the necessary advisories are sent. That is number one. Second is the vaccination, the government has centralized it, except for the 25% of the private hospitals. And government is now undertaking the responsibility of supplying these vaccines to various parts of the state and every state government. The procurement agency is now one. This is some sort of a centralization that the central government had to resort to because states were unable to negotiate with the vaccine developers and get enough vaccines. I think that's a good move by the central government. It's a very strategic move to ensure that there is vaccinations for all, and the vaccination is proceeding at quite a swift pace, and it will gather much more steam in days to come. And as we move on, I think that's the goal that the central government is hitting at, to vaccinate all, number one. and to ensure that in the meantime, the sort of concern, the sort of protective measures that we must take as against this variant of concern is taken. I think the central government
But
has also
central
been
government
quite.
seems to be sitting very quietly, and the BJP governed states seem to be encouraging the view of holding all kinds of religious congregations, all kinds of yatras. Thousands of people are going to be traveling through multiple states, and we are going to be, just standing by and watching. But if a few hundred people get to a hill station to escape the heat from the national capital, then we start calling them COVID idiots. Now, why do we have these dual standards, Mr. Reddy?
Well, I think this is the decision to be taken by the state governments. Central government has issued advisories and said that you cannot hold, you cannot, you should ensure that COVID proliferation of super spreading is prevented. And it is the state governments that must take a decision, whether it is a BJP ruled state government or a non-BJP ruled state government. I think all the state governments will have to take a decision and protect their citizens against the exposure to COVID. So we expect the state governments to take a decision, because this time, unlike the first lockdown, where even the lockdown was centralized and directions were given for throughout the nation, this time we have asked the state governments. It is a localized lockdown.
So you don't think it's a problem that Uttarakhand and Uttar Pradesh are going to go ahead with the Kanwar Yatra right now? You don't think that's a problem at all? When such a big hue and cry was created over the Char Dham Yatra, where the state government was willing to take on and fight for it in the courts, and the courts had to come down heavily and say, no, this is not going to happen. Have you learned no lessons from the Kumbh Mela?
I think the objective must be, an objective decision must be taken by the state government based on the sort of cases that they have. Uttarakhand is a different state, having different, it may be in a different part of a COVID, for confronting a different COVID problem. So Uttar Pradesh may be confronting a different COVID problem. So we cannot use one formula for all. It depends on them. And we expect that they will take a decision that is best suited in order to prevent the super spreading.
Mahesh Tapase, would that be a fair strategy? That while I understand that the states would want to be able to decide, but if we keep saying that, the states will say, oh, but our cases are low, so it's okay if people from neighboring states want to come, visit and go away, it's not going to be a problem for us. We saw in the example of Kumbh Mela, the devotees and pilgrims who went back to their home states. Actually, that's where the trouble then happened.
Exactly, it's a very tricky decision which I think the central and the state government will have to take, and here we do not want to push the blame from one government to the other. My friend Mr. Reddy rightly said that the government did its best, but it had to do the vaccination drive only after getting a rap from the Supreme Court. So in the first place, they allowed the states to do the vaccination, buy the vaccination, and the second they amended their own order, so which was good. Nevertheless, in this new circular which they have said for a COVID appropriate behavior and not opening up this thing, and again passing the buck to state government, we have to have a very conclusive policy. States might have different figures. The figures in UP might be different than what they are in Maharashtra or West Bengal or in Kerala, Uttarakhand. Yes, advisory by the national government to the citizens at large. This can be definitely spoken by the Prime Minister or the Health Minister. Now that we have seen a new Health Minister taking charge of the ministry 2-3 days ago, it means that something was not right and something has been put. It's made to do right now. So let's hope that advisories are coming and they need to be followed. But nevertheless, if thalis can be banged and diyas can be lightened up, so people can definitely be told not to go and enjoy too much. They can definitely be told that tourism is one aspect. People see. I just read a very, very new term, revenge tourism. I don't know what it meant. I think it meant that people are just too tired of sitting at home and they just want to go and visit a tourist destination just as a revenge to being kept home for almost over a year. So this new term, revenge tourism, is very harmful, I guess, not only for the people at large, but if we have the third wave, fourth wave, the Delta, and I don't know what Gamma, if it comes, then it will be a very bad situation for all of us.
Yeah, there was revenge shopping last year that the experts warned should not be taken too seriously, because after a certain point, it can't be taken as economic revival unless it's sustainable. And this time it's revenge travel, with people coming out with a vengeance after being locked up in their homes for days together. They've also gone through the trauma of first wave and more importantly, the second wave. But Dr. Jayalal, maybe that's why it's more important for your association to take this head on, because at the end of the day, if it's also your fraternity which will have to bear the brunt. If people went through the trauma with their family members in the hospitals, the doctors, the nurses, and the medical staff who've actually worked through the last 1.5 years and will have to do that again when the third wave comes.
Exactly, because in the last second wave, when it has come rapidly, nearly 800 of our young doctors have lost their lives, and because we were on the front line to face that disease. And now we know very well, obviously we know, we have seen for sure that how we can prevent the disease. And knowing that very well, and if you are not adapting to that, and that is only paining us, that is why we have made this appeal to both the government and our public that there is only hardly 2-3 more months. And if we can still stick on to the COVID appropriate behaviors, then definitely we will be able to go to a positive status. And locking down for 1.5 years, we all have tolerated this. And let us also hope for that helping our each other person and helping our communities. Let us adopt the self-lockdown. That is the best principle, like what Gandhiji says is the self-ahimsa technique. And if we can, all of us take a oath that I will follow a self-lockdown within me. And unless it is inevitable, I will not come out. And definitely that is going to give a long way for our country. I am sure our Honorable Prime Minister has very strongly given an advice to all the state government to listen to that, and they will be hear the voice of our Honorable Prime Minister and enforce a strict stopping of these mass gatherings in our state.
Mass gatherings. I think mass gatherings need to be the easiest one to do, where you just say no. We understand people need to get out. We understand people need to travel. We understand people need to go to work. We understand, businesses need to reopen. But nobody can really justify mass gatherings. But for some reason, those are the ones that are actually getting the permission more than the individuals who need to step out, who get questioned for not wearing a mask, but not those in these, big, large congregations. What should the policy be? We've now repeatedly said that we can keep appealing to people. We can keep taking this message across to people to please follow COVID appropriate behavior. If that doesn't work, what should the policy be? Let's say good evening to also Dr. Vishal Rao, member of the Karnataka COVID Task Force. Dr. Rao, how is your team really looking at it? At what point will you, turn around and say, okay, we understand you need to take a break, but this is not allowed?
Good evening, Tanvi. I think the most important point is to draw a line between economic activities in an unlocked time versus social and entertainment activities. And I think this is a very, very clear distinction that you need to draw. And I think time and again, state is also making this very important message to the public to say that economic activities are being done in order to survive the health of the economy, and which is why the state government has taken some very, very proactive steps in order to save the daily wages, the people who are working for their monthly salaries to survive the economy. However, this is not the time to promote social and entertainment activities, because this is a socio-economic virus, and the more you do, the revenge travel that you're going to do is going to be a revenge against yourself. This is going to be, we've just overcome the foolishness of April. We cannot expect ourselves to be roaming around traveling and then expect the government to arrange beds and oxygen for us.
Okay, so let me ask you this. For example, where would you put the tourist hotspots? For states like Himachal and Uttarakhand, their argument is, well, it is also our biggest source of revenue and income. And, hundreds of people living in our states depend on this tourism. We are tourism states. So then how do you manage that kind of a situation, Dr. Rao?
Very good point. So, a lot of the times economy is very closely entrenched to social and entertainment, and this forms one of those categories. Now, if you look at countries that have actually derived some amount of messages from this, countries have used the principles of biobubbles, or to look at how to connect between two states where there is minimal positivity rate, but not to open up the entire floodgates towards a complete mixing of cases. What we need to understand is, like what Singapore is following or an Australia is following, there has a sensible method in which you are going to be able to connect, wherein the two states have very minimal positivity rates, allow those states to open up tourism within themselves in a restricted manner. But if you open the floodgates of tourism to anybody and everybody, mixing it up, you're actually not even creating a third wave. I would call it extension of the second wave. Please do not think that the second wave is over, because there are still thousands and thousands of active cases in each state, or lakhs across the country which are active cases, and the positivity rate is still at a few percentages, but that cannot be considered a premature victory.
We seem to be, okay. So let me turn it around and say this, Vivek Reddy, the central government seems to be reiterating the same thing as what Dr. Rao was saying right now. Dr. Aravindan would say the same, or Dr. Jayalal. Central government last week in all of its, news briefings, health ministry news briefings, reiterated that we should not let our guard down. And what did we see over the weekend? We saw traffic snarls going all the way from Dehradun to Mussoorie, all the way from Mumbai to Lonavala to Pune. And I'm sure it was pretty much the same even in Karnataka with people headed towards Coorg. So that's clearly these advisories are not really seeing any effect on ground. What will the states do then?
Well, I think, Tanvi, we are seeing this sort of proliferation in travel throughout all the states. I mean, it's the same in Karnataka. We saw in Nandi Hills yesterday, the first Sunday, the whole Nandi Hills was crammed, and then we had vehicles with huge queues down to the bottom of the hill. So we are seeing this in all states. And I think we have to now sensitize people to stay back at home, because it appears that the gap between the so-called first wave and second wave is now getting minimized, and the gap between the second wave and the so-called third wave is getting very, very short. So people are in the danger zone, and it is since all these days there was a clampdown. Governments have released the clampdown, and everybody is traveling, and it is very difficult for the governments to do anything unless people themselves realize that COVID appropriate behavior is the sort of behavior. I mean, you can tame and mend. You can do everything. You can issue advisories. You can issue statutory orders. And you can clamp down and issue restrictions. But we can't be in a clampdown mode forever, because economic activities have to move ahead, have to accelerate some strength. So therefore, what we see today is that we need to now raise the consciousness of the people, and people themselves must come out and try to limit their sort of exposure to COVID, to exposure to travel, and to ensure that, they are safe. And it is very, very I think, prudent to now withhold, because in infection carriers, the vaccinated people can be infection carriers, and they can take it to their children who are unvaccinated. So we see that the most vulnerable population emerging now are the little children, for whom there had been all these lockdowns and school closures. Therefore, I think that today it's over to the people. Economic activities are unlocked, and they cannot take it as a free-for-all.
Okay.
And we, as a people, will have to limit.
So let me just turn this around now and take it to Dr. Aravindan. Dr. Aravindan, your argument was that we also need to track, what's the occupancy in hospitals, what's the burden and the impact we're seeing on the healthcare services, and accordingly design our policies as the cases go up or down. But in the past, we've seen that, often we've been too slow in reacting to that kind of information, where suddenly, if you're going to start holding festivals, whether it's in Kerala, Maharashtra, Uttar Pradesh, or wherever, the big crowds lead to a large surge in numbers, and then the system begins to crumble.
Yeah, to what I said earlier, I would also like to add that one very important thing to make decisions is a proper recording and reporting of events, the cases, actual number of cases, actual number of deaths. So if we keep on giving wrong figures, or if you take the entire India, the number of deaths, for example, are we underplaying it to very, very large numbers? When you look at the excess deaths from the registration data, in various states, it said that 20, 30 times it has been underestimated. So we are probably, because of this, we are also underestimating the people are underestimating the seriousness of the disease. We have had a very big toll, and the extent of the toll is probably underplayed. And it is high time that we give actual figures, and so that people can really take stock of what the real situation is. So that said, of course, I agree that unlocking of the economy is very important, and we have to do it in a controlled way. But definitely, things that we can postpone, we can definitely postpone. No? So it's one thing that to unlock the economy, to let many of these normal economic activities go on. And it's another to really crowd around in festivals and places. What you said is very right, because that is really challenging the virus in a way, which we shouldn't do. So we have to take a very pragmatic view regarding the economy. At the same time, not indulge in extravaganzas of various kinds.
So I'll ask you the same question as I did for, to our other panelists. Where do we put in the tourist hotspots or tourism dependent states? Where do we put in religious congregations? Is that required, not required at this point of time?
I think we have to postpone it till the end of the year. No doubt about that.
Till the end of the year, until we get a larger majority of people vaccinated?
Vaccinated.
Yes. Okay. So Dr. Jayalal, would you agree? Postpone it till end of the year at least, both of these aspects?
I definitely agree with that, but I will still hope we even may not go up to the end of the year. Even if we have to go up to October, November, I think that will be the best time that definitely we will be reaching that vaccination and we will be able to overcome the disease. But positively, will put us up to the December.
We're not saying that, Mahesh Tapase. We are not really seeing that reflective in what our states are doing. The experts, all experts from all associations to task force members seem to be telling us that, listen, this is not the right time. But none of the state policies seem to be reflecting that.
See, like I said, the state is caught between revenue on one side giving medical treatment to the infected people. There are huge delegations meeting the state heads, whether it's the state of Maharashtra or any other state in the country, whether it's a BJP ruled state or a non-BJP ruled state. The delegations by hotel industry, the delegation by small shop owners, and specifically those states who are more dependent on tourism, like whether it's Kerala or whether it's Goa or any other state. So definitely the state governments, it's a challenging task for the head of the state government to decide how much to open up, whether to open up, whether not to open up, and take a calculated risk, because we know for sure that it might surge, but nevertheless, it's like putting a warning on a cigarette packet. Please don't smoke, otherwise you'll get cancer. People see that it's still smoke. I mean, it has come down to that level. Now, if you see the figures of vaccination in the rural parts of the country, in the tribal parts of the country, people are not wanting to get vaccinated. This is the truth. I mean, in urban cities, yes, all of us have got vaccinated, but what is the vaccination drive happening in the rural parts of India? Rural parts of Maharashtra, people are scared to get vaccinated. They are still having certain foreways about the vaccination. And post-vaccination complication, they might have read one article somewhere about a post-vaccination complication, and that has sunk so deep in the minds of people. What is the state of vaccination in the state of Bihar, in rural Bihar? In the rural parts of Maharashtra also, similarly, people are still quite resistant to vaccination. And these are the people who form the bulk of the tourist-driven economy. So we have tourists coming from other states. We have tourists who may not be in appropriate COVID behavior. We have seen how partying is happening. We have seen rave parties, bungalows being booked in Puri, and film personalities partying with people, and police again raiding them and booking them for this kind of activity. So by and large, the state machinery is geared up. I mean, people are watchful, but there is only little which any government can do. Ultimately, it is the people who have to take the onus upon themselves. We can't blame the medical fraternity. We can't blame the failing healthcare system if suddenly the graph goes up. It surges to what it was in the month of May or in the month of April. So that time we had a very horrific figure. I mean, God forbid if that kind of time comes again, it will be very difficult for all of us. We have been taxing the medical workers since over 1 year
Yeah.
with
Well,
minimum tax. They
I
have
think it's also a lot about the implementation of what your existing rules are. You know, if there are weekend lockdowns and people are stepping out to travel to the local weekend getaway destination, you stop them, you penalize them, and you send them back. But if people are allowed to travel, then instead of harassing them, you get to the tourist spots where when you see a large crowd with people not wearing a mask, congregating in large numbers, then you act over there. I think even in terms of implementing the policy and penalizing people, Vivek Reddy, we have to become very clearer. And the second aspect, since you mentioned vaccination, are we looking at a plan? Are states looking at plans where you are actually prioritizing those who need to step out, open their shops, restart the economy in terms of getting the vaccine? The point that Mahesh was making, that a lot of these people in smaller towns and villages are the ones running these economies but are not yet vaccinated.
Well, I think Karnataka has had a very robust prioritization on the basis of those who are exposed to the pandemic. There were initially the COVID warriors, and then there was a list of about 20 to 25 people from various segments, from laborers to advocates, from cartwalas to persons from professions which really get exposure to COVID. I think that priority sector section is getting these vaccinations first. And the interesting thing is that government and the local bodies are going out to the advocates associations, to various places, and giving the vaccination at places where they go to courts or at places where they go to work. And that's very important. It's a very robust and aggressive vaccination program that is being undertaken. I'm sure the same thing is followed in all states. And the interesting scenario here is today that with this robust vaccination, we hope to really stem that curve and ensure that it does not spike. And as we go ahead, I think this will eventually happen, because in foreign countries, they say about 70% vaccinated population will really be able to spurn this virus, or to, allow this virus to retract.
Well,
So that is what we are
I think
focusing on.
before we're able to reach that point, we'll definitely know if it's worked in the other countries, whether it's in US or UK or any other country who've opened up after a majority of the population was vaccinated, and what the impact will be, we'll know in some time. But very quickly, Dr. Aravindan, is that a sound policy to follow? Maybe focus and prioritize now groups further beyond the healthcare workers and frontline workers, and then the elderly, to say, okay, those who are in, running these businesses who need to step out on a daily basis, let's give them vaccine first. Does it help?
Yeah, it will definitely help. There are people who are more likely to spread the disease. If I just take an example, the people who deliver food, like Swiggy and other things. So there are many such groups of people who need to be vaccinated first. But we also have to bear in mind that those who have had the first dose, especially the older people and at-risk people who have had the first dose, should also get the second dose. Because there is some data that show that the higher risk people, with one dose with the new variant virus, they do not have that much protection as having a second dose also. So both these we have to go hand in hand. It has to go.
Okay, quick word from Dr. Rao also on this as a policy before we wrap up. Dr. Rao, I think no matter how much we ask people to stay indoors, no matter how much we debate religious congregations, unless and until the courts step in some manner and put a stop to it, it will continue. And people will get out from Nandi Hills to Lonavala and to Mussoorie. So, when it comes to vaccination, do we need to have this kind of, and is it being done? Are states now beginning to look at such a plan?
Yeah, I think already we are seeing the non-government organizations, NGOs, and a lot of institutions trying to create such kind of activities in clusters to kind of prioritize economic groups, especially the lower socio-economic groups who are actually working for day-to-day wages. We are seeing that a lot in Bangalore, where organizations have come forward and put together programs for rickshaw drivers, for daily wages, and try to encourage small congregation of these groups. But this is happening in small pockets, and this needs to be, I think, enhanced to a much larger scale, where priority groups of economic priority groups need to be actually taken into vaccination drives in a more systematic manner. I think the other point I would like to add before closing is I think we also need to move from awareness and strengthen enforcement at this point in time, because now we need to move from health department doing only awareness to municipal departments, home department, and other departments coming together to strengthen enforcements in each state.
All right, on that note, I'm going to thank all of the panelists for joining us on this conversation. I think we'll continue to have these conversations because it's very important to emphasize on what is happening on ground and accordingly tailor our policies and plan for what comes next. And when this is happening on ground, then it's obviously a concern. But I just want to put out a word here for all of those governments, administrations, experts, people who are questioning anybody who steps out and tries to get away for a weekend, for a single day, take a break, catch a break, visit a hill station. Also keep in mind that we often give legitimate approval to large-scale religious congregations, to political rallies, to large-scale events that are beneficial for us or our vote banks, including local polls which are not exactly essential to be held right now, to grand weddings if it's related to the powerful people, and nobody blinks, nobody raises a finger or utters a single word. None of it should be allowed, not even irresponsible holidaying or revenge travel to the extent where you forget about COVID norms. Not even the crowded markets that you see in Mumbai or Delhi or any other city which is any which ways very vulnerable to a rise in cases. And not even religious congregations, no matter whether it's Kumbh Mela, Char Dham or the Kanwar Yatra. If you're going to have rules and regulations for COVID appropriate behavior, our response has to be the same for all kinds of threats and not only those which are easy to target. Think about it. Thank you for joining us.